Our next speaker, I'm going to just read her little blurb, and then I'm going to speak to you personally about her. So her name is Alison Walensky, and she's 26. She's a 26-year-old breast cancer survivor. She credits her incredible team at NYU Langone Health for the treatment that saved her life, and Planned Parenthood for their willingness to listen to a woman's healthcare concerns and refer her for proper scans. Since starting treatment, Allie has written about her experience for the Huffington Post, Lilith magazine, and is starting a blog about the physical and emotional side effects of cancer treatment that are not often talked about. She hopes to continue to speak out about the state of women's health care in the U.S. and advocate for the organizations that saved her life. So I just want to say on a personal note, Allie is a patient of mine, and as an oncologist, as I think we all hope that the people that we see, the older they are, the better, because we certainly don't like to see young people with such serious diseases. And when I met Allie and her family for the first time, I have to say I was blown away by her incredible maturity, way wise beyond her years, her incredible, wonderful, compassionate family. And she went through treatment with such grace and poise that every day was magical for me to see her. And I'm so happy to report that she is healthy, beautiful, doing incredibly well. I am so proud of her and of her family, and so honored to be her doctor. It's my great privilege to bring up Allie Walensky.
Okay, so Dr. Myers said I could say anything in this speech, so it's going to get a little dark, but it has an uplifting ending, so I promise. So, first, I need to thank all of my doctors, nurses, and various staff at NYU Langone Health for not only saving my life, but also saving my sanity and making me feel like a person during a very dehumanizing time. Just a few shout outs to Dr. Myers, Dr. Schnabel, Dr. Levine, Dr. Smith, Dr. Norris, Dr. Nitty, it really does take a village, Dr. Rosenthal, Thelma, Deodra, Akila, Amanda, Lisa, Caitlin, Lauren, Sarah, Kimberly, and Shanetta. And I want to mention that I just listed 16 medical professionals, and out of those 16, 14 of them are women, so just a little applause for that. I think it's awesome. And I didn't go to them because they were women. I went to them because they're the best, and they just happen to be women. So I was trying to think of what to talk about for Survivorship Month, and I wasn't sure whether to discuss my time during chemo, my surgical recovery, maybe my initial diagnosis. And I've been NED now for a year and 6 days, so I started thinking about what this past year has been like. After I was diagnosed, someone told me that once you have cancer, you always have cancer. And I thought that couldn't be true, because once I was done with treatment, then I wouldn't have cancer anymore, and I can go on living my life. And while that's probably one of the worst things to say to someone going through cancer treatment, I'm finding it to be accurate. I have the BRCA1 gene mutation, which means my chances of getting breast cancer again or getting ovarian cancer are high. I need to get a mammogram or MRI of my breast and an ultrasound of my ovaries every 6 months until I decide to remove my right breast and my ovaries. That means about another 10 years of getting scanned, waiting for results, and possible biopsies. I still need to get heart echoes for another year because of Herceptin. I have another surgery planned in August to get my fallopian tubes out to reduce my risk of ovarian cancer. Even if I do a double mastectomy, I have a 1 to 3% chance of getting breast cancer. And even after I get my ovaries out, I can get non-ovarian ovarian cancer. So it really seems never ending. All this brought me to a really dark place this year. And I started thinking, is it all worth it? Do I really want to keep going? Do I want to go on? And then I remembered my doctors, the people who worked to save my life. They spent so much time and effort and care to make sure that I could be alive. That means that any appointment I had or any time I spend with them could have been spent with someone else who desperately wants to live. I was lucky enough to have Lilith magazine ask me to review In the Body of the World, Eve Ensler's new one-woman show that had a 6-week run at the Manhattan Theater Club this year. It was about her battle with stage 4 uterine cancer. Throughout the show, she talked about her work in the Congo. Cancer is rarely talked about in the Congo, she said. The word is hardly used. When people get it, it's usually too late as there is no CAT scan machine in all of Bukavu. Even in the US, I have 2 friends whose doctors wouldn't listen to them when they noticed a lump in their breast because they were too young for breast cancer. One of them ended up being diagnosed 6 months later. The other is still waiting for an ultrasound 4 months later. People don't have health insurance or access to tertiary medical centers. Yes, having to make continuous doctor's appointments sucks. It feels like it's never ending, but that's a lot better than it being ending. I have the privilege of getting an MRI. I am lucky to have surgery in a sterile environment with highly trained professionals. I've told my incredible boyfriend, Alon, that sometimes I don't want to be brave or strong, and sometimes I just want to lay on the floor and cry. And I do, because like I said, cancer sucks. But now I appreciate the small things, like being able to eat fruits and vegetables, or not being worried about if there's a bathroom 10 feet away, because no matter how much Imodium and Pepto-Bismol you take, it's just not working that day. Chemo things. The challenging part is I thought being sad and anxious is a normal reaction to a cancer diagnosis, which it is, but what I needed to ask myself was, when is the reaction within reason, and when is it a pathology? Everyone around me seemed so much happier than I was, and at first I thought they were just naive or stupidly optimistic, like somehow I knew more than them about how awful this world is. There's a difference between knowing why you should be here and really wanting to be. I was also a strong, independent woman who was used to multitasking and handling stress, so I don't get overwhelmed, and even if I did, I prefer to solve things myself rather than ask for help. Looking around and seeing joy but not feeling it made me realize maybe I'm the odd one out. I contacted Dr. Myers for a referral to a psychiatrist and made an appointment. Now, talking about this in a 5-minute speech makes it all seem easy because it's 5 minutes long, but it took a long time for me to come to terms with. It took years. It's a process, and it's not an easy one. So if you know someone who's not there yet, it's okay. And if you're the one who's not there yet, it's okay. You need to find that thing that keeps you going, keep going. Cancer is traumatic for the person going through it and for everyone around them. Life after cancer is a new normal, or as it's put in the show, next to normal. I don't need a life that's normal. That's way too far away. But something next to normal would be okay. And that's what I strive for now. My body doesn't look the same. My mind doesn't function the way it used to. But I'm still figuring all this out, and I will be for a while. But in the meantime, all I can say is thank you, NYU, for saving my life, and I promise I don't take that for granted.